Good evening. You're with the Urban Debate with us this evening. I'm Sahar Zaman. Thanks for being with us. Tonight, we're going to be discussing a huge concern in Uttar Pradesh. Barely a few days after about 24 of its districts were declared COVID-free, and a case load which was down to 250 across the state here. Uttar Pradesh right now in certain districts is staring at yet another outbreak, but this time it is believed to be related to dengue. But it's also important here to remember that this is a seasonal dengue outbreak. This is something that happens annually, every time, this given time of the year. And it's not dependent as far as authorities' preparedness here is to control this outbreak. This year specifically, somehow, there have already been an unprecedented number of deaths that have not been seen in the dengue outbreak that the state has faced in previous years earlier. As far as 2021, this seasonal dengue outbreak is concerned, right now, so far, we're looking at 65 deaths, which includes 51 itself from the worst affected district of Firozabad, and the central government already indicating that these are signs of a dengue outbreak. There were over 400 children believed to have been crammed in one single hospital in the worst affected district, which has a capacity of just 100 beds. We're going to throw this open to our panelists in just a bit here. But first, also, more importantly, taking you across the figures that we have. First, let's get you the city-wise breakdown that we have of this outbreak that has been seen this year. In the worst affected district of what we have in Firozabad, confirmed cases of over 100 and the death toll of 51. In Mathura, which is the second worst affected city here, confirmed cases 50 and a death toll of 14, which is how we are reporting about 65 deaths so far. We've also noticed here that down the years, dengue deaths haven't been that high. If we take into account those figures that have come in of dengue fatalities reported each year, right up to 2015, high number of deaths reported in 2016, 2019 also had 26 deaths. But important to note, so far in 2021, a figure that could still rise is a fatality of 65, the highest ever that we are seeing so far already. So what is causing this? What is exceptional this year? And what has gone amiss in the system which has caused this nature of an outbreak? We're going to be throwing this open to our guests this evening. We have Mr. Govt, leader of the Uttar Pradesh Congress with us, Mr. Sanjeev Sinha, co-convener of the Jan Swasthay Abhiyan, Dr. Sharad Kumar Agarwal, who is the National Chairperson IMA for Uttar Pradesh, and Mr. Raman Malik, spokesperson of the BJP. Good evening, gentlemen. Many thanks for being with us here. First, making a start with Mr. Sanjeev Sinha, who is with the Jan Swasthay Abhiyan. Mr. Sinha, in your understanding, why has this outbreak been exceptional this year? Why have the numbers been so high this year?
Thank you. शहर जमा जी, सबसे पहले तो आपने एक अच्छे विषय पर डिस्कशन किया जो इस समय करंट इशू है। दो चीजें समझने की हैं। पहले तो ये कि उत्तर प्रदेश जैसे राज्य में जहाँ पे कि इंफॉर्मेशन सिस्टम बहुत वीक है और जो करंटली में इस तरीके की पेंडेमिक के समय में भी हम लोग के पास इंफॉर्मेशन बहुत परफेक्टली नहीं आ पा रही है। और जो वीक हेल्थ सिस्टम है हमारे यूपी का, उत्तर प्रदेश की अगर आप 23 करोड़ की आबादी को देखें तो 23 करोड़ की आबादी के मद्देनजर जिस तरीके से स्वास्थ्य व्यवस्था इस प्रदेश में होनी चाहिए वो उस प्रकार नहीं है जितने की घोषणाएं हैं या बातें हैं। और डेटा में ये आंकड़ों में उलझा करके सरकार और सरकार के जो नुमाइंदे हैं वो इस तरीके से बताते हैं जैसे कि बहुत इंफ्रास्ट्रक्चर में और हेल्थ सिस्टम में बहुत इंप्रूवमेंट आ गया है, बहुत ज्यादा सुधार उसके अंदर दिख रहा है। अभी जो हालात है ये कोई नए हालात नहीं है। ये अगर आप देखें तो गोरखपुर के पूरे रीजन में और इधर बस्ती के पूरे इलाके में या कुछ हद तक बिहार के इलाकों में जापानी इंसेफेलाइटिस का एक बहुत भयंकर प्रकोप रहा और उसको कंट्रोल करने या उस पर जो ट्रीटमेंट और जो इंफॉर्मेशन वहां पर आनी चाहिए, जिस तरीके से ट्रीटमेंट दिया जाना चाहिए या जिस तरीके से उसका पूरे कंट्रोल करने की जो प्रोसेस होनी चाहिए आप देखेंगे कि वो हमारे पास पुराना अनुभव है कि वहां भी फेल हुए, और अभी हम इस सेक्टर में, इस बेल्ट में कि इस तरीके की डेंगू के एक नए प्रकोप से हमारे जो बच्चे, हमारे जो एडल्ट वहां पर बीमार होकर हॉस्पिटलाइज हो रहे हैं। प्रॉपर एक एक हॉस्पिटल के अंदर की जो इन्फॉर्मेशन है वो ये इन्फॉर्मेशन है कि पर्याप्त बेड नहीं है, पर्याप्त रूप से वहां पर डॉक्टर नहीं है, पर्याप्त मेडिसिन और ट्रीटमेंट जिस तरीके से मिलना चाहिए वो भी नहीं मिल पा रहा है। तो हम एक मरीज को सम्मानजनक तरीके से भर्ती करने की स्थिति में नहीं है। इस परिस्थिति से हम ये समझ पा रहे हैं, और आप इसको इस तरीके से भी देखने की कोशिश करिए।
So essentially, you're saying that this is lack of health infrastructure. Despite having gone through COVID, we haven't really seen an health infrastructure upgrade here, despite certain claims that have been made by the government. Dr. Sharat Kumar Agarwal, would you like to step in here on this? In your understanding, are you in agreement of what ground reality here indicates, that these deaths are not necessarily, yes, of course, cause of deaths being suffering from dengue, but it's also because treatment not available in time, or not enough beds for treatment, medical centers, hospitals, still not enough?
See, it's very easy to blame anyone, but outbreaks are outbreaks and they cannot be planned. Like we have gone through and we have seen in last 1.5 years. We have gone through the pandemic and world is going through the pandemic, and no one has planned this. And see, there are the bed capacity and the hospitals are made and built on the projections of that how many percentage of the population is going to be admitted. But in case of outbreak, there are shortage of the bed,
Right.
and it is worldwide. Number one. Number two, the doctors shortage is not a recent one. Doctor shortage we are seeing for decades. Though definitely there has to be some few shortcomings. If I have to see this, I will see it like the government has taken action. Chief Minister has visited the place, and the today's information which I have, the medical college, they have they have got 30 more doctors in last 7 days to join the medical college in Firozabad. Today itself, there are around 400 children admitted in the Firozabad Medical College, and 100 has been discharged successfully. And out of 500 total dengue patient, only 3 deaths were reported in the medical college. We have to understand the cause of death. The cause of death is not because of the shortage of doctor or the shortage of the beds. Maximum death roll came from the rural area, the villages adjacent, I think 3 or 4 villages which are badly affected due to dengue around Firozabad. And the reason is why? Because there are lot of unqualified practitioners who claim to be doctor, as we all know. This is the same scenario in entire country. So because the simple villagers, they don't know the difference of the qualified doctor and the non-qualified doctor. So people are being treated there as a simple fever.
No, but that's because qualified doctors are necessarily not even available. Primary health centers sometimes in certain areas are shut. Mr. Gaurav Kapoor of the Congress, would you like to step in here on this? Of course, no one's saying a pandemic is planned in this manner here. But this is also seasonal fever. I'll come back to you in just a bit. I'll come back to you, please. Mr. Gaurav Kapoor, this is also seasonal outbreak. Why has a seasonal outbreak gone out of control in this manner, in these figures? 65 fatalities already.
You see, first of all, I'd like to congratulate you, to organize a debate of actual meaning rather than just, issue at hand. But this is a larger issue that the citizens of Uttar Pradesh have been facing. You see, from the first wave of COVID that hit us, misgovernance of the Yogi government has been absolutely clear to everyone who was associated with the healthcare sector. Whoever had to deal with, and especially, the second wave hit us so hard. There has been no preparations. I'll give you a very simple figure. This is a UP government figure. PHCs and CHCs that have to be created every year. In 2020, a UP government report themselves have said that they've only created less than 50% of the number that they were supposed to. Now, this government just does not want to learn. I don't know what this government does. I don't know what Mr. Yogi does. Lawlessness is at its worst. But healthcare, if you already knew in the first wave what was happening, you had to start preparing. And from that, you could have prepared for dengue. If it comes every year, maybe with COVID, it could have come worse. You had to listen to some experts, which they never do. It's the same problem with Modi ji, it's the same problem with Yogi ji. Now, the sufferer is the common citizen of this state. The state is about to go to polls. So, of course, a lot more movement will happen. A lot of people will come and, want to see what's going on. But reality is that if you want to see rampant misgovernance, you just have to look at the healthcare sector. I would like to, in fact, give them a little piece of advice. Maybe they should go back and read some good history. In Uttar Pradesh, when Lokpati Tripathi ji was the health minister, some of the greatest things were created in terms of that healthcare sector. And that same healthcare sector is what sustained them, especially in rural Uttar Pradesh.
Mr. Raman Malik, would you like to step in here on this? Because at the end of the day, it's about health infrastructure. It's not about not being able to treat dengue, which is largely now a simple fever with respect to medical advancement here. If we look at the worst affected district, Firozabad, it is a fact that deaths have happened because hospital bed was not available, a doctor in the community health center was not available, the health center in the district was shut. It was opened only after the chief minister visited it.
So, sir, am I supposed to answer only to your question or the rhetoric that was also given by Mr. Kapoor and Mr. Sinha? Can I answer to them first and then revert to you?
Can we stick to answering on facts that are indicating on ground?
Yeah,
in your understanding, why has it gone out of control in this manner?
As an anchor, Sana, as an anchor, I was expecting you to be more researchful on what has happened in UP. Please ask this gentleman who's there.
No, but this is exactly what I'm saying. Based on my research, it is irrespective of what every other panelist has said. I have specifically raised the question basis cases that have come in from Firozabad. This is a fact. This is based on our research. This is not based on what. This is not based on what other panelists are saying. As far as my question to you is concerned, Mr. Raman Malik, if we look at the worst affected district of Firozabad, please answer what's happened there. Yes, please go ahead.
Mr. Sinha was not aware, neither are you aware of the number of hospitals that have been opened up in this government, the number of which have been announced and the ones which are operational. So please get that fact and please understand that rhetoric does not work. People of Uttar Pradesh know that their CM has been working around the clock for every need of theirs, and the kind of response that has come from the Honorable Chief Minister is par excellence. There have been people across, MPs from Australia have asked that, they've said that they would like
Mr. Raman Malik, you say a lot number of hospitals have been opened. You're not giving us the number. But despite that, people are dying. Can you please respond to that?
I will not let you do this, that you stop me in between. I've very patiently heard everybody. Now you tell me the same Kerala model which the Congress and your channel had also been promoting and saying that they were, oh wow, what a great thing. Where is it standing now? It is giving about 2/3 of the total corona cases in the country. Now let's come back to this particular issue. Has the CM not visited? Are changes not done? Has the CMO not been removed? Has there been new induction of new doctors? Yes. Now let's come up and talk about another fact which needs to be understood. There are multiple variants. The doctor sitting on your panel can answer this also. There are multiple variants of this dengue, and it is expected, even the national virologist team that went from Delhi, communicable diseases and others, they actually have suspected that because of the symptoms, it could be a non-existent or let's say a non-commonly found variant of dengue, which is known as some variant 5, where there are symptoms of high
Okay.
fever, drown in platelets, and also a lot of pain in the stomach. So it is expected out of the national team also, when they did the research, they said it could be possible that this is the 5th variant of the dengue, which is generally not seen in India. Now, that fact would not be spoken by you.
All right. No, I'm going to go across to Sanjeev Sinha here, because you've also responded to what he said here. And Sanjeev Sinha, important to note, a political panelist here with us. He's the co-convener of the Jan Swasthay Abhiyan. Sanjeev Sinha, आप इसके बारे में क्या कहना चाहेंगे कि जो फिरोजाबाद की डेथ्स हुई हैं, क्या ये शॉर्टेज की वजह से हुई हैं, नेग्लिजेंस की वजह से हुई हैं, या प्राइमरी हेल्थ केयर सेंटर्स अवेलेबल नहीं थे? ये क्या हुआ है फिरोजाबाद में, क्योंकि फिरोजाबाद में अभी मैक्सिमम डेथ्स देखी जा रही हैं?
मैं सिर्फ 2 बातें कहना चाहता हूं। एक तो इस सरकार के जो हमारे साथी हैं, मैं उनका बहुत सम्मान करता हूं, लेकिन बहुत ही सम्मान के साथ मैं ये बात कहना चाहता हूं कि उत्तर प्रदेश की आबादी के हिसाब से 30% हेल्थ सब सेंटर और पीएचसीज कम है, और लगभग 40% सीएचसीज कम है, और जो कि इस गवर्नमेंट में इस पर कोई फोकस अभी तक नहीं है, पहली बात। दूसरी बात मैं ये कहना चाहता हूं कि गोरखपुर के इंसिडेंट से भी हमने नहीं सीखा। गोरखपुर में इस तरीके का पिछले सालों में जो हमारा जापानी इंसेफेलाइटिस के जो बच्चे बीमार हुए, लेकिन हम जो फिरोजाबाद, मथुरा, इस बेल्ट में जो देख रहे हैं, उसमें भी जो पब्लिक हेल्थ सिस्टम,
नो लेट हिम कंप्लीट प्लीज।
पब्लिक हेल्थ सिस्टम के जो पब्लिक हेल्थ सिस्टम वीक है, और जिस तरीके से प्राइवेटाइजेशन, नीति आयोग ने, आपको मैं बताना चाहता हूं कि नीति आयोग ने अपने डॉक्यूमेंट में डिस्ट्रिक्ट हॉस्पिटल को प्राइवेट हाथों में देने की बात की है। तो सरकार की जिम्मेदारी यह बनती है कि पब्लिक हेल्थ सिस्टम को स्ट्रेंथन किए बगैर इस तरीके के महामारियों को या बीमारियों को आप कंट्रोल नहीं कर सकते।
कहां ले जा रहे हैं सेना साहब?
अभी लास्ट में मैंने आपकी बात सुनी, हमने अभी
सवाल है
So let's have Dr. Agarwal answer this here. Let's very quickly have Dr. Agarwal respond here to this. Dr. Agarwal, this is about the UP government not opening up enough health centers. आपने भी ये कहा कि फिरोजाबाद में CMO सैक कर दिया गया है, मेडिकल ऑफिसर, और डॉक्टर्स बुलाए गए हैं। डॉक्टर अग्रवाल, आप हमें बताइए, ये कांग्रेस भाजपा की बात नहीं है, प्लीज रमन मलिक। डॉक्टर अग्रवाल, आप हमें बताइए कि अभी स्थिति ऑन ग्राउंड क्या है, ये कैसे इस बात पे सहमति लिए जाए कि हॉस्पिटल्स आर इनफ बट पेशेंट्स आर अनेबल टू रीच द हॉस्पिटल इन टाइम। डॉक्टर अग्रवाल,
see, as I mentioned in my opinion, in my opening statement, see, whenever there are outbreak, so definitely whatever arrangement you have in any society or any country, there going to be shortage. The problem is this particular case is that the outbreak is, the death toll is mainly, maximum is from the village area, rural areas, and that is because of they don't have the qualified doctors there. And that is definitely, there must be some shortage of the doctor at PSC or the facility at the PSCs. But all the patients are not going to the PSC. There are a lot of, why the government is not running that, campaign of catching the unqualified doctors. Why they are practicing in the openly. So they've been giving the steroids and the aspirin, which should not be given any dengue fever. Because the death is because of in dengue, there are already a loss of the lack of platelets. And these NSAID, aspirin and steroid, they again decrease the platelet and patient land up in the dengue shock syndrome. Because of that, maximum deaths have happened. See, strain can be 4, 5, 3, but the more basic treatment remain the same. But if the wrong treatment has been given by the unqualified people, then that is very unfortunate. So if I have to say, yes, there can be some shortcoming from the administration that they have not taken the proactive action in fogging. Because see, in all these seasonal outbreaks, viral.
Absolutely. No,
The
Dr.
prevention
Agarwal, you named it, that this is preparation before the outbreak, expected outbreak of the season, which is expected to be done here, because this is annual fever, this is seasonal fever that we're looking at. So perhaps there has been a shortcoming with respect to preparedness here in the build-up to this outbreak here. Should this have been better handled by the UP government? Because we're already looking at the highest death toll related to dengue that we're looking at. And we're going to be ending with leaving you with these images that have come in from Mathura. There is an old man really literally touching the feet of the chief medical officer in Mathura, begging the officer to save the lives of his village in Mathura. This should not be the condition here of people where one has to beg for basic access to health infrastructure to resolve a fever outbreak, to resolve what the villagers, for lack of understanding, just call a mystery fever. But at the end of the day, it is just dengue. It is far more manageable and should have been done better by the government there. Thanks for being with us.